بسم الله الرحمن الرحيم، والصلاة والسلام على أشرف الأنبياء والمرسلين سيدنا محمد وعلى آله وصحبه أجمعين. Assalamu alaikum wa rahmatullah. I'm Nazik al-Malaika, Professor of Pathology at Durman Islamic University. Welcome to this presentation which is about an introduction to ovarian cancer. And in this short time, we are going to briefly talk about anatomy and the physiology of the ovaries, the epidemiology of ovarian cancer worldwide and in Sudan, know what are the common risk factors, symptoms, and the clinical stakes. As you know, the ovaries are the organs that produce sex hormones and the ova. Their size is about 4 centimeter long, 2 centimeter wide, and 1 centimeter thick. They are almost oval or almond in shape and located in the pelvis. There are 2 ovaries in a woman beside the uterus. Ovarian cancer accounts for 3 to 4% of cancers in women, so they are not common. They are the 4th most frequent cause of cancer-related death in females in the United States and the 3rd in Sudan. Ovarian cancer is the 2nd most common gynecologic malignancy, following endometrial cancer. However, it is the most common cause of death among women who developed a gynecologic malignancy. They are lethal cancers. In general, ovarian cancer is a disease of the postmenopausal women, disease of elderly, and the highest incidence among patients aged 65 to 74 years worldwide, and in Sudan it starts from 55 years. Here, this figure is from a paper published 2016. You notice that ovarian cancer is number 3. And in this paper, most of the cases in Sudan present late, either in stage 3 or stage 4. Stage 4 accounts for 43% of the cases and 21% present in stage 3. So about 64% of the cases present either in stage 3 or stage 4. And the median survival time in Sudan was 31 months according to this publication. That is to say 2.5 years. The presenting with advanced stage disease is mostly the predominant factor that results in a short survival time for women. Risk factors. The commonest risk factors of ovarian cancer are the family history, ethnicity, some factors related to reproduction, and a few other factors. Family history is the strongest risk factor. A woman with a single first degree relative, that is mother, sister, aunt, with ovarian cancer, has a relative risk of approximately 3.6 for developing ovarian cancer compared with general population. And her lifetime risk is approximately 5%. About 5 to 10% of ovarian cancer are linked to identifiable inherited mutations in certain genes that we will come over it later, inshallah. Families in which 3 or more first-degree relatives have ovarian or ovarian plus breast cancer are likely to have a cancer susceptibility genetic mutation that is transmitted in an autosomal dominant inheritance pattern. There are 3 familial ovarian cancer syndromes. The first one is the site-specific ovarian cancer syndrome, in which only ovarian cancer is seen, no other organ cancer in other organs. And it accounts for 10 to 15% of hereditary ovarian cancer. The second syndrome is the hereditary breast ovarian cancer syndrome, and this is very common. associated with 65 to 75% of hereditary ovarian cancers. And the third one is the hereditary non-polyposis colorectal cancer syndrome, rare, not very common. And the affected individuals may have colon, endometrial, breast, ovarian, or other cancers. These are the most common familial ovarian cancer syndrome. The most common one is the hereditary breast ovarian cancer syndrome. Ethnicity in ovarian cancer is important, and ovarian cancer is higher in white women, higher in North America and Northern Europe than Japan, for example. And the difference can be related to genetics, diet, or environmental exposure, or a combination of all these factors. Breast cancer and breast cancer 2 genes, نقول BRCA1 and BRCA2 genes, are more common among white women of Ashkenazi descent. These are some of the genes related to the familiar syndromes, particularly ovarian breast cancer syndrome. The incidence of ovarian cancer is higher in countries with higher per capita consumption of animal fat. And the factors related to reproduction includes nulliparous. Women do not give birth to a child, or the first child birth occurs after the age of 35 years, or involuntary infertility, infertile women, or late menopause or early menarche, and patients with prolonged period or uninterrupted ovulation. So ovulation is important. The normal physiology is good. Other factors include exogenous hormones, hormone replacement therapy taken by some menopausal women, and dietary factors. The diet higher or rich in saturated animals fats seem to confer an increased risk by unknown mechanisms. And in one publication, it was noticed that Japanese women who moved to the United States have an increased ovarian cancer risk. While the ovarian cancer is low, it's less prevalent in Japan, these women, when moved to United States, they get a high risk of ovarian cancer. This is probably could be to environmental factors or dietary factors. So the protective factors include multiparity, giving birth for more children, or the first pregnancy being before the age of 30 years old. The use of oral contraceptive is also acts as protective factor. 5 years of use cuts risk nearly in half in one publication. Tubal ligation, hysterectomy, and bilateral ovarectomy is used for the protective measure in patients with proven genes or gene mutations, BRCA1, BRCA2 mutations, for example. The lactation is a protective factor, and the epidemiologic and laboratory evidence suggests a potential role for retinoids, that is vitamin A, vitamin D, non-steroidal anti-inflammatory drugs, as preventive agents for ovarian cancer. There are no specific symptoms for ovarian cancer. However, it is proved that there are early symptoms. However, they are not specific, they are vague. The early symptoms include pain in the pelvis or pain in the lower side of the body, either the lower limbs or the lower abdomen or even the abdominal cavity, and back pain, and indigestion or heartburn, symptoms of irritable bowel disease or acid production, increased acid production, more frequent and urgent urination due to compression, feeling of heaviness, pain during sexual intercourse. All these symptoms are non-specific. They mimic other conditions, but prove to be present months or years before the diagnosis of ovarian cancer. As ovarian cancer progresses, these symptoms are also possible: nausea, weight loss, breathlessness, fatigue, and the loss of appetite. But when these symptoms appear, usually it is too late and the disease is already in stage 4. The clinical stages, there are 4 stages. In stage 1, the tumor is confined to the ovaries, either to one ovary in 1A or both ovaries in 1B, or in addition to the surface in 1C. In stage 2, the tumor reaches the peritoneal cavity, and the patient may present with ascites, that is a collection of fluid within the peritoneal cavity. And in 1B, even the bowel is involved, or the bladder. In stage 3, the lining of the abdomen the tumor reaches the lining of the abdomen. In 3A, it is only seen microscopically. In 3B, the tumor is 2 centimeters or smaller. In 3C, even the lymph nodes are involved. And in stage 4, the tumor metastasizes outside the pelvis and the intestine and reaches the other organs like the liver and the lung. In conclusion, we have to remember that although ovarian cancer is a less common cancer, accounting only for 3 to 4% of cancers in women, it is not silent, and early diagnosis may save lives. Ovarian cancer have always been thought as a symptomless disease, but research has shown this is to be untrue. There are symptoms. Unfortunately, they may be subtle, that they are attributed to other benign conditions. And in 81% of the respondents in one research, they realize in observation that symptoms exist before diagnosis, with these symptoms being confused with irritable bowel syndrome, for example, or premenopause, or stress acid reflux, endometriosis, gallbladder issues, or other ailments. And it is the time to break the silence, educate yourself and the women you love. And thank you. Wassalamu alaikum wa rahmatullahi wa barakatuh.